What's up, guys? Dr. Hunt again at Hunt Physical Therapy. Today we're going to talk about headaches, specifically a type of headache called cervicogenic headache. I see quite a few patients in my clinic with this type of headache. A referral source of mine is a neurologist, and all of her patients that have been diagnosed with migraines that aren't responding well to the traditional migraine medication, she sends over here. And so what is a cervicogenic headache? It's a headache, but it's a headache caused not by internal vascular issues like with migraine. It's a headache caused by damage or injury to the structures in the upper neck, namely the joint, the muscles, the nerves, the connective tissue. And so the input from pain in the upper neck, it feeds into a nerve in the cranium called the trigeminal nerve, which in turn sends signals to pretty specific parts of the head, like the temporal region. You can have a headache around the eye. We call that the retroorbital region, and the base of the skull. And so what's the main differences? They do share some common characteristics, but consistently what I see in my practice, the headaches that are coming from the neck, they tend to be on one side and they don't move back and forward like migraine can from side to side. Also, unlike migraine, with cervicogenic headaches, a lot of times there's loss in range of motion. For example, one side will be really tight and you'll see reduced range of motion away from that tight joint that could be causing the headache. Also, you don't see that sensitivity to light and sound and feeling nauseous like you do a lot of times with migraines. And so anyway, before we get started on things you can do for this particular headache, there are some red flags you need to be aware of. So if your symptoms are matching any of these red flags, before you do any treatment on yourself or go seek treatment elsewhere, it's a good idea to go to your medical doctor and get these things checked out just for safety. Another way we can diagnose cervicogenic headache in the clinic, when I get my patients on the table, a lot of times when I feel on the painful side, it'll reproduce that headache. And then there's a test we can do in the clinic where you basically flex the head and maintaining that flexion, rotate. And a lot of times the headache side, the painful side, it'll be restricted. And you don't see that with migraines as much. And so now let's talk about some things you can do for this frustrating type of headache that often gets misdiagnosed or overlooked. So first thing first, we talk about this all the time. You gotta watch your posture. So that's so important. I'm gonna backtrack a little bit. In one of our other videos, we talk about TMJ pain. And guess what? The TMJ is supplied in large part by the trigeminal nerve. And so people that sit with their head forward like that and their shoulders rounded, that causes a lot of compression in the upper neck. And so that compression can injure and damage those joints and tissues we mentioned and stimulate that trigeminal nerve, cranial nerve, and cause headache symptoms. But also just being like this can cause TMJ pain. So watch your posture, sit up straight, shoulders back. Now I'm going to show you something you can do with a towel. So let's say the headache's on the right side and you're really tight in C1-2 or C2-3. Try this stretch at home, okay? So take the towel and just kind of put it like at the base of your skull or the upper cervical spine. I'm going to turn sideways so you can see pretty good. So again, this is going to be the right side we're going to stretch, and I'll show from a couple different angles. Look up and then side bend towards the tight side like that. And then gently take the towel and put it kind of on the angle of your jaw there, and then rotate towards the top eye. Don't force it. You don't have to be super aggressive with this. Sometimes you'll get a little pop in the neck. Again here, look up, side bend, take the towel, and rotate up towards the tight eye. And just do like some oscillations with this, or just take it a couple times, just rotate a little bit just to stretch that tight joint out. Again, don't force it, don't take it to where it's painful. A little discomfort's fine, but again, don't force it. So watch your posture, do this joint technique, and now I'm gonna show you some things you can do on the table for this. Okay guys, here's a couple stretches and exercises that you can do at home on a bench if you have it, or your bed, that's really good for addressing cervicogenic headaches. So the first one is a strengthening / stretching exercise called a chin nod with deep cervical flexion. So basically, we've done this before, so this may be reviews in some of the videos, but tuck your chin down like that. Almost like somebody has their fingers on your chin and they're just pushing your chin down towards the table. So tuck your chin, and without losing that, lift your head up. It's going to be hard at first. A lot of times people with cervicogenic headaches, and just a history of chronic neck pain in general, those muscles are really weak. So a lot of times when patients start doing this, they won't be able to hold it very long, or the muscles will, it'll feel like they're letting go. And so just try to hold 3 to 5 seconds, but eventually, build up to 10 seconds. And you can do, 3, 4, 5 repetitions a few times a week. So again, I'll do a couple. Tuck your chin, and then maintaining that chin nod, lift your head up. Hold 3 to 5 seconds, build up to 10 seconds or more, and do that a few times a week. Tuck, flex, hold for 3 to 5 seconds. And there's nothing wrong with holding it 20 seconds if you can do it that long. The more the better. So that just means you're getting stronger. So one more time, tuck, flex, and hold. Okay? Exercise I like to give my patients, it's really good for strengthening the cervical spine. Take one of these rubber bands. You can get these almost anywhere. Of course, we prefer you shop at HpT&x, so we have these on our website now at HpT&x. So take this around your head, and with this particular exercise, what you're going to do, you're going to rotate away from your hand so that when you turn your head, you're rotating into the resistance of that rubber band. And just listen to your body. Go as far as you can. If you feel pain, back off a little bit. And of course, you want to do both sides. So my patients in my practice, I tell them shoot for, 20, 25, 50 reps a few times a week. Okay. An added bonus, studies have confirmed this. A lot of people with chronic neck issues, they're tight in their mid-back. So, if you've got a bench at home, this is useful, or in the gym, just kind of back up to where your mid-back is hanging off the table, cross your arms like this, and just sink back until you feel a couple pops or releases in your mid-back. And you can kind of move up and down a little bit. There we go. Got a couple little clicks there. Okay guys, now we're gonna go out in the gym and I'm gonna show you some of my favorite posture exercises. So let's go. All right guys, last two things I wanna show you. I gotta show you some postural exercises. So these exercise bands work really good. You can get these also at HpT&x. So I'm gonna show you two of my favorite posture exercises, which is rows and straight arm push down. And so think 3 sets of 15 reps a few times a week. And so just grab these, and you just want to make sure that you've got adequate resistance, but just to reinforce that good posture, bring back, pinch those shoulder blades together, chest out like that, strengthen all those muscles that promote good alignment. So that's why we do these things. So I'll do a couple more reps. Three sets of 15 a few times a week, and then push down, keep the arms more straight on this one. This one biases the shoulders a little bit more, I think. But again, chest out, pinch those shoulder blades together. Okay guys, try these things for that cervicogenic headache. It'll probably help. If it doesn't quite knock it out, then come see somebody like me in the clinic and get trigger point dry needling or more advanced joint mobilization techniques, and that usually really helps. I see really good results. As a matter of fact, I just posted a short on a young lady. She's got migraines too, but a big component of her headaches was coming from her neck, and after 4 visits, she's 75% better. So anyway, that's pretty awesome. We appreciate your support as always. Please subscribe to our channel, leave comments below. If there's anything specific you guys might want to see, just let me know. And again, appreciate your time and support, and we'll see you next time. Thank you.